Our main speaker this evening is Dr. Sung Hong, DDS, naturopathic MD. Dr. Hong currently has a biological dental practice in Sunnyvale, California. She sees patients with full range of dental health needs, from single tooth decay to all matters of complex endodontic and periodontic cases. Her interests lie in the process by which dental health affects systemic health. In this pursuit, she has received advanced training in TMJ studies, electrodiagnosis, orthodontics, and naturopathic medicine. Additionally, she has received advanced training in the use of lasers and ozone dentistry. Her training commenced with a DDS from University of Pacific in 1992 and continued through a mastership from the Bioresearch Institute. She also has completed a 2-year residency through the Institute of Advanced TMJ Studies and completed a postgraduate course on advanced orthodontics. In 2012, she received a naturopathic medicine degree from American College of Integrative Medicine and Dentistry. She is a member of the following professional associations: the International Academy of Oral Medicine Toxicology, the International Association of Biological Dentistry and Medicine, the American Association of Ozone Therapy.
Thank you. Good evening. It is always surprising to me that many of us, even physicians, have failed to appreciate how important our oral health towards total health. Who would have thought that your nagging hip pain or knee pain or chronic fatigue for so many years, that those symptoms may be related to what's going on in your mouth? My hope for this evening is to help you realize that oral health is not just maintaining a nice smile or being able to eat food, but even some serious disease such as cardiovascular disease, chronic fatigue, or autoimmune disease, or chronic arthritis may be related to what's going on in your oral health. With that introduction, I'd like to go right ahead with a program for this evening. I want to talk a little bit about the biological dentistry and the dental connection to the rest of our body, and dental amalgam and mercury toxicity, and other types of dental material that is going on in dental office and toxicity issue, and the focal infection theory, including cavitation and root canal myth. And least but not least, how wonderful ozone can be used in dentistry. The dental and oral condition can be understood only in relation to the whole body. Your oral tissue are physically, energetically connected to every other part of you. Biological practitioners know that the body reflects what goes on in the mouth and that the body reflects what goes on in the body. Dysfunction or disturbance in our one area will eventually and invariably show up as illness in related area of the body. So this is a good example where what's going on in the mouth will affect the whole body. Can I have this video play? I don't know. Oh, no. So this is a woman who came to Dr. Robert Rowan's office, and I'm so happy that he's going to be here speaking next month. And what he did was, patient came in with the low back pain, and
back pain?
Yes, thank you. So the patient came in with the low back pain, and Dr. Rowan did some muscle testing and found out that there is a focal infection.
Walk towards the door, please.
In the mouth. We can do it again. Should I start? That's fine.
All right, and come on back and sit down. And now let me see you turn your head to the right, to the left, as far as you can. Bend it back. And now bend it down. Okay. You can look straight ahead. So what was it that you said to me earlier that I made a comment?
I think I said I doubt that.
You doubt that with regard to what?
That you would be able to help me with my back problem.
Okay. Because you didn't come in here for a back problem.
No, that wasn't what I came in
right.
for
And the viewer doesn't have to know what you came in here for,
Okay.
but you just happen to have a back problem. I said, well, maybe we can help, and you said,
I doubt it.
I doubt it.
Sorry, I don't mean to
Okay.
distrust you. It's just that usually the C1 treatment usually takes care of it.
Understood. And I'm not promising you that I can help it. But for the viewer, your back pain started after you had some dental work, didn't
Yeah.
it? And it was in tooth number 30, right?
Yeah.
Okay. And how long ago was that tooth removed?
What has it been? 2 weeks ago.
2 weeks ago. So you've been in pain for 2
Mhm.
weeks, correct? In your back. Your back
Well,
pain
it
just
didn't
came
start
on.
right away.
Right.
It started about a week ago. Yeah.
Okay. I'd like to try something with you, if I might.
Okay.
Can I put a little local anesthetic into the area of the tooth?
What kind of anesthetic?
Preservative-free 1% Procaine.
Okay. Is it gonna hurt?
Very little.
Okay.
Very, very little.
Okay.
Okay, thanks. So I want to see what the range of motion is in your back. Can you bend over and touch your toes, please? Okay, come on up. Was that very hard to do?
Not very
Can you bend
hard, but
side
it
to
was-
side
I'm not
like
as
this?
I wasn't as flexible as I
Mm.
usually am. This is hard.
You can't go to the
left, I
side,
can't
all
go
right?
left.
And how about the other side?
More. I
A
can
little
go
bit more. It's not
more,
real
but
good.
not total.
How about rotation of your lumbar spine? Let me see you rotate your shoulders to the right.
Rotate my shoulders to the right.
In other words, watch me.
Watch you.
Okay, now rotate your pelvis, please. No, not your pelvis itself, above your pelvis. Not much. And, okay, see, you're turning your pelvis when you turn. When I do it, I'm able to keep my pelvis in the same plane and just rotate my whole upper body. That's hard for you to do. Okay, all right, let's go ahead and do something with your tooth now. Okay, Rachel, we just injected your tooth about 25 seconds ago. Can you get off the table and sit down on that chair, please?
That is easier. That's easier.
Face me. Please stand up.
Yeah, it's easier. Oh my gosh, that's amazing.
Say that again.
That's amazing.
Say it again.
It's amazing.
Now, please go to the door. All right.
It's easier. Walking is easier. How can that be so quickly?
Now, say that again.
How can that be so quickly?
And what is easier, you said?
Walking. Walking is easier.
All right.
Wow. This is called prolotherapy?
No, this is not prolotherapy. I'll explain. Please sit down in the chair.
Wow, yeah. Oh my. Oh, there was a reason why I came here today, huh?
And once again, please get up. Okay.
Patient had a root canal, extraction done, and probably didn't heal properly, and that infection from the extraction site probably transferred to the rest of the body, and that's a very good example of that.
You'll have to space for it's going to start.
Just go, okay. Nothing happens. All right. Okay, perfect. So the periodontal bacteria can enter the bloodstream and travel to major organ and begin new infection. Periodontal disease can contribute to the development of heart disease, which is a nation's leading cause of death. It also increases the risk of stroke. It increases a woman's risk of having preterm, low birth weight baby. It also poses a serious threat to people whom health is compromised by diabetes, respiratory disease, or osteoporosis. Oral infection, such as periodontal disease and C-reactive protein. Researchers have known for quite some time that elevated C-reactive protein level increase the risk of cardiovascular disease. A recent study published in the New England Journal of Medicine identified elevated CRP levels as stronger predictor of a heart attack and not cholesterol. However, many clinicians were unclear of the cause of elevated CRP levels. A study published in the Journal of Periodontology reported that inflammatory effects from bacterial infection of the gum or jawbone can cause oral bacterial byproducts to enter the bloodstream and trigger the liver to make protein such as C-reactive protein that inflame arteries, promotes blood clot formation. So you see the infection from the gum can go to the heart or any part of the body almost instantaneously. The ancient Chinese medical science states that the body has electromagnetic energy flow along invisible channel called acupuncture meridian throughout the body. The ancient traditional Chinese medicine taught that the main cause of sickness is an imbalance of energy in the body. Even before the disease actually occurs, there must be an alteration or disturbance in the body's electromagnetic field. This concept was unacceptable to the scientific Western mind for many decades until the two French medical doctors provide the existence of this channel through radioisotope tagging in 1970s. Since then, more and more medical practitioners worldwide have studied the benefit of acupuncture for the patients. And then later on, Dr. J. Thompson and Dr. Reinhard Boll in Germany have mapped the electromagnetic connection between every tooth and specific organ, glands, muscle, or joints in the body. So here you see that this is the tooth and organ chart, and they found that, let's say if you have a problem with the front teeth, those areas are connected to the urogenital tract in our body. So for example, if you have a root canal or infection of the front teeth, that may lead to a problem in your kidney, prostate, or sexual functions. So one of my patients had an infection on one of the tooth, and when I took it out, she claimed that she has a, libido like crazy. So that's one example of that. And if you have a problem with wisdom tooth, then that may lead to, that can affect the heart or small intestine. And many things can disturb this field, such as poor nutrition, chemical in your food, pesticides, harmful electromagnetic fields, bad bacteria, fungus, virus, harmful poison, like heavy metals, trauma, stress, and many other factors. And we are bombarded with these toxins, and so that's a bad news. I mean, all of us are toxic. Where all this toxic come from? It is, we have a problem with phthalates, plastic, formaldehyde, soaps, shampoo, laundry softener, lotions, dry cleaning agent, halogen, processed food, and we have to deal with the fluoride in the water and chlorine. How about the teeth? We have metal crowns, implants, and the mercury toxicity and the toxic associated with the removal. We have a plastic, methacrylate, or acrylic in the mouth. We have a fluoride in the mouth. All those fillings has a fluoride, in some fillings. And we have a BPA containing composite fillings, and we have to deal with the infection and biofilms. So what's the big deal? The biggest problem in creating health is the ability of the body to clear toxin from constant exposure. Our fat tissue and all cells continue to stockpile this toxin throughout life. A backup of toxin load can cause major oxidative stress in our system. And if any of our detox systems are not working properly, it leads to degenerative disease, cell death, or eventually the system can shut down. So what is the oxidative stress? Oxidative stress is a disturbance in the pro-oxidant and the antioxidant balance, and usually increase in pro-oxidant level, which may be achieved by either an enhancement of oxidative reaction leading to the increased formation of reactive oxygen species, or decrease of antioxidant defense. There is nothing that induces oxidative stress faster than the mercury. Mercury is the most toxic non-radioactive naturally occurring substance on Earth. The concern is that mercury in amalgam filling in our mouth slowly changes to a vapor over the lifetime of the mercury filling, causing a wide array of disorders. Mercury can cause mitochondria to turn into free radical producing factories. Mercury blocks the end of electron transport chain. The amalgam filling that you have in your mouth are 50% mercury, and the rest made up of silver, copper, tin, and zinc. Mercury can easily change shape and state, going from liquid at room temperature to a gas at slightly higher temperature. According to the Environmental Protection Agency, dental amalgam is the primary source of exposure, emitting mercury 24 hours a day, 7 days a week. As Boyle-Haley points out, according to NIH study, about 90% of the mercury in our body is elemental mercury, not methylmercury, showing the exposure to more likely to come from dental amalgam rather than a fish. The inorganic mercury is most cytotoxic from the mercury. So why do we put a mercury filling in our mouth? That's what I was taught when I was in dental school. American Dental Association claiming that when mercury is combined with other metals as used in dental amalgam, its toxic properties are made harmless. Is that true? If I didn't learn it in school, it can't be true. The most tragic result is conventional dentistry continued advocacy of the use of known poison mercury in amalgam filling, and their reason for doing so, because it's been done for more than 150 years. The difficulty lies not so much in developing new ideas as in escaping the old ones. So every time you eat and drink liquid, especially hot liquids, you have a tiny but potentially dangerous bits of mercury that are being released into the system. And the inorganic mercury that are coming from mercury filling can transform into methylmercury in our organs, liver or the gut, throughout the membrane. And those methylmercury can accumulate in any parts of your body, such as brain, the liver or kidney or gut. And this is a DVD from IAOMT. Can you play that, please? It's called Poison Gas.
All mercury silver fillings leak substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations that are at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher than the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist and they drilled on your tooth? Here is the mercury vapor every time you raise the temperature to 110 degrees with hot coffee or warm water, or even chewed on it. Mercury comes off fillings every time you stimulate them, and that stimulation causes the mercury to continue to leak out of the fillings for an hour and a half at a minimum. Some people grind their teeth. Some people chew gum. The dentist might send an old gold crown to the dental lab to be welded. How about the dental personnel? They're not being given informed consent. Back in 1985, the International Academy of Oral Medicine Toxicology set out to determine the amount of mercury that was coming off fillings. And here's the graph, showing substantial quantities of mercury were measured coming off fillings. And then we estimated the total dose. And then we began animal experiments and put radioactive fillings in sheep. Mercury accumulated in the jaw, stomach, liver, and kidney of the sheep in just 30 days. Substantial quantities of mercury spread from the fillings to every organ in that sheep's body. This should be of concern for everyone. Then we measured that the sheep's kidneys dropped in their ability by 60% to clear inulin, an indication of kidney malfunction. Whole body imaging of monkeys found exactly the same thing. Proponents of amalgam fillings claim that sheep chew too much. Well, what's the problem with monkeys? They had mercury in their jaw, kidneys, liver, intestine, and heart. And further research found dystrophic bacteria that were antibiotic resistant cropped up in the intestines within 2 weeks of receiving these mercury-leaking fillings. Further studies have found damage to the ADP ribosylation of brain neuron proteins. In response to the controversy, and at the request of the Federation of Experimental Scientists and Biologists, Drs. Fritzloh Scheider and Murray Vimy wrote an editorial, the first ever in FASEB, that point by point refuted the claims of the amalgam proponents. In 1991, the World Health Organization acknowledged that the predominant source of human exposure to mercury is from your fillings. That should be of concern to anyone wanting to have healthy children, because mercury is highly damaging to fetuses. Experiments in sheep showed that mercury from the sheep's fillings transferred immediately to the placenta, to the unborn fetus, and to every conceivable portion of the fetus's body. It even increased in the lamb higher after birth from mercury in the mother's milk. There's no such thing as a safe mercury filling.
So here you saw and heard how fast and how mercury can transfer to the rest of your body. Especially, when you're trying to have a baby, and if you have a mercury filling, that's pretty scary. So.
Yeah, we have to start at the beginning.
Oh, really? Okay, that's okay. Luckily, that's the last video, so. Any questions so far? Yes?
Can you comment in any way on you showed examples of animals having this mercury absorption. If you were then to allow the animal to live a week, 2 weeks, whatever, what amount of that would dissipate naturally through natural means? In other words, is that level a perfect level, temporary level?
Good questions. Our body is not designed to deal with the heavy metals. So we try to deal with it, but as long as you have a mercury in your body, it's just not going to go away on its own. So you have to chelate them out. You have to have a special mechanism to get rid of the mercury in your body. Sorry, I take it back. We do have a glutathione system in our liver that try to take out the mercury, but you have the proper nutrition. You have to have a means of getting rid of the mercury. Yeah, you're welcome. Mm-hmm. Oh yeah, go ahead.
When you showed the video of Dr. Rao
Thank you.
The video of Dr. Rowan, what was he doing? What did he do to her? Was it just injecting Procaine,
Yes.
or did he do something else?
Yeah, what he did was he just injected Procaine into the extracted sockets. And Procaine is known to revascularize that area. So it actually repolarize the membrane around the area, so the body can access, oh, maybe there's nothing wrong with that area anymore. Yeah. So how does the newborn get mercury? Research also shows that mercury can freely pass the placental barrier and can cause physical and mental birth defect in the newborn. If a female is pregnant, nature protects the mother at the expense of the fetus. The concentration of mercury in the blood of the newborn is 28% higher than the mother's blood. Here is an example of someone who has a 10 amalgam filling. The first line over here is methyl mercury, and this is inorganic mercury. The amalgam filling is inorganic mercury, and most of the inorganic mercury is excreted to your urine, and the methyl mercury is excreted to your hair. So as you can see, the level is almost towards the maximum. So you can tell that how dangerous all this mercury, contributing to the body. And over here you have a urine to blood ratio, and there is a hair to urine ratio. So let's say if you have certain amount of mercury, let's say you have, hypothetically, you have 1 microgram of mercury. You should have 1 microgram of mercury coming out of urine. But if you have, this patient has a very low level of kidney function because she's not excreting the mercury. So she's retaining all this mercury in the body, and that's accumulated in the body throughout life. And this slide, the Christopher Shade from Quicksilver Scientific states that inflammation in your gut causes down-regulation of your natural detox pathway in your liver. So here you have mercury filling, and those are inorganic mercury. And those inorganic mercury, the corrosion parts of the inorganic mercury get swallowed with the saliva and cause inflammation in your gut. And what happened in the liver, normally liver has a 3 detox pathway. The phase 1, which is called activation phase, that's the enzyme, 450 enzyme pathway, and bodies try to recognize those heavy metals and try to get it out. But phase 2 takes place now. The glutathione system is the one that is responsible for getting rid of the mercury. And the phase 3 is called the transport system and elimination system. But when you have inflammation in your gut, it down-regulates phase 2 natural pathway in your liver. So what happens when you do that, you get backs up of toxin in phase 1, causing major oxidative stress in your body. And inflammation in your gut also down-regulate transport protein, which cannot get out of your body. That is kind of answer to your question about that. The liver has to work properly in order for you to get rid of the mercury. Yeah. What is the mercury safety limit? The amount of mercury vapor in the average mouth is 80 times above the established safety limits for mercury vapor exposure, according to US standard. This means that most people have a mercury filling, has a high mercury level. So what are some effects of mercury in the body? Mercury causes autoimmune dysfunction such as fibromyalgia, multiple sclerosis. It also causes heart disease, high cholesterol, and triglycerides. It is also susceptible to chemical sensitivity. I mentioned to you about inflammation in our gut. It causes allergy, antibiotic resistance infection. It also blocks energy flow in acupuncture meridian, leukemia, adrenal, thyroid glands, and kidney dysfunction. It also causes chronic fatigue, candida and yeast infection, peripheral neuropathy, decreased dopamine production, insomnia, lack of enthusiasm, and anxiety. And what the patients observe, and also the physician noticed that people who remove the mercury filling, a lot of these symptoms goes away. So what is the solution? We can support our detoxification pathway by changing diet, like I mentioned to you, and taking some supplements such as glutathione, lipoic acid, vitamin C, or maybe chelating agents, zeolite or EDTAs. But what good is it if you have amalgam filling in your mouth? We can actually detox our system by removing mercury filling itself using safe protocol. So there are some good ways and bad ways to get rid of mercury in the dental office. The Marlin study shows that when amalgam fillings are drilled out without adequate protection, the subject exhibits 3 to 4 times increase in blood plasma mercury in the next day and 50% increase in urine mercury for months following amalgam removal. So here you have, when you take out a mercury filling with a high speed, you have a cloud of particles that you're inhaling, and it goes deep into the lung, and whereby all the particles are broken down, and the mercury is systematically absorbed within a few days. And by then, mercury can deposit in all these parts of your organs. So what is a better way to remove mercury? The Marlin study shows that use of a rubber dam eliminates a spike of plasma mercury 1 day after amalgam filling has been removed. So we use a dental dam over here to protect from, particles going into their mouth, throat. We also have supplemental air that we provide the patient breathe so that they don't inhale any other toxic material. We also have external suction here that also take away all the mercury vapor surrounding the operating field. Now, I want to talk a little bit about the oral galvanism. It's a toxic battery. When you have a mixed metal, such as a metal partial crowns or gold crowns or implant, mercury fillings, it is like a small battery in your mouth, which creates an electric battery signals, and that signal can interfere with your own biological signal in your brain. And amalgam itself has a mixed metal right there. So when you have crowns, I can tell what's underneath of it. You might have a mercury filling underneath of the crown unless you drill out the crown. So that's very common to have a mercury underneath of your crown. So now we have a toxic mercury drilled out, and we're going to replace it with another toxic material. And that's a composite filling, and that's bisphenol A. One of the most common chemicals in modern life. BPA is a common component used to make polycarbonate plastic, including baby bottle, infant cups, water bottles, eyeglasses, iPhone, bike helmets, children's toy, self-adhesive label, computer, food can liner, epoxy resin, cars. Dental resin composite has the BPA. Worldwide, BPA generates estimated $1 million a day for crops such as Bayer, Dow, GE Plastic, and Sunco. To avoid plastic in this day and age is almost impossible. This is a big new tobacco of our generation. So what's BPA? The building block of BPA is very similar to estradiol. It is like estrogen mimicking substance. Scientists have now linked low dose of BPA to alter development of mammary glands or vagina or prostate and decrease sperm production. It is an endocrine disturbing substance. So what are some risks of using BPA? If you use in young children, it can have a hormonal effect. You will see some 5-year-old kids will have breasts, you know. If you use in woman's teeth, it could promote hormonal change or even stimulate estrogen receptor, causing estrogen-sensitive cancer such as breast cancer. If you use in men, it could have a feminizing effect. So recent study published in the Journal of ADA reports that place of resin-based composite restoration was associated with detectable increase in saliva BPA within 1 hour after placement. We have another toxic material in our mouth, and fluoride. You know, how many people use a toothpaste with the fluoride? It has been shown increased cancer in rats, mice, and humans. Fluoride depletes mineral from bones and muscle and has been shown to increase hip fracture in people living in fluoridated water. It also shows that fluoride does not reduce tooth decay. And US EPA experiment on rats and mice and rabbits and dogs exposed to sulfuric fluoride develop holes in several parts of their brain, cerebrum, and white matter and hypothalamus. Despite EPA scientists push to stop using fluoride, on February 7, 2014, Farm Bill just passed saying that by the Obama allowing to be sprayed on food such as dry fruits and nuts. That's bad. So now we talked about a lot of toxic material that is going on. Now we have to worry about the infection in the mouth. The focal infection theory. A dental infection is the only infection that the body cannot overcome on its own. Even a small amount of toxin and infection in the oral cavity can slowly metastasize in some other parts of the body, which are resistant to therapy until the infection has been removed. Root canal often become hidden focal infection that could cause problem at a distant referral site. The root canal and cavitation can seriously sabotage your health. Weston Price, what he did was he saw a patient who had a kidney disease or cardiovascular disease, and he removed the root canal tooth, and he implanted the root canal tooth under the skin of the rabbit. And that rabbit lost weight and sickened and died. In fact, the rabbit died within 48 hours. So, and then he took out the same root canal tooth and implanted another rabbit. And the same thing happened. It got sickened and died. And he did that 30 times. And those rabbits who was implanted with the root canal tooth had the same disease that human donor had. And he did another experience. He did a healthy tooth and a coin implant under the skin, and nothing happens. The rabbit went on years without any problem. So root canal tooth is a big issue in dentistry. So why does the root canal fails? It is very difficult to do the proper root canal procedure, for one thing. It is mechanically impossible to sterilize tooth due to the presence of dentinal tubules and extra canals and curved canals. You will see that this is a tooth, and that's a pulp. All the rest of it is composed of dentinal tubules. And you see these many holes coming out of it. It's just like each tooth has 3 miles of dentinal tubules, and if the bacteria are living in their tubules, it's very hard for us to clean those areas. Effectiveness of apical seal due to the shrinkage issue. And we also use a toxic material like gutta percha. Gutta percha has mercury, barium, and lead also. But that's another toxic issue right there. What could be the argument of the root canal? every time you bite, those anaerobic bacteria that was those living in the dentinal tubule that I showed you are flushed into the bloodstream, causing bone degeneration as well as immune challenges. If you have a healthy immune system, it's probably not an issue, but the moment you have a compromised immune system, you will have a potential problem. So this is a microflora of the root canal tooth that induce periodontal lesion. So this X-ray was taken today, actually. The patient came in, and you see she has a little bit of problem, but look at this tooth. That one has a root canal, and that one has a root canal. If you look at the bone level here, it's pretty high, except this tooth. So what it means is that all the bugs that are living in those dentinal tubules, every time she chews, they probably comes out and cause osteonecrosis around that area. So that's a big issue with that. You know, the infection can come out from the tooth to cause the bone destruction around that area. So now we have a new responsibility. If we are going to keep the teeth, root canal treatment must be including cleaning the dentinal tubules. But the question is, can we disinfect the dentinal tubules? Probably not, because there's millions of bugs there that we just cannot get to. Endococcus faecalis bacteria, which is prevalent in root canal tubules, and they always come back. Dr. Isaac Eli's observation, root canal tooth linked to cancer. He had a patient with aggressive breast cancer of the left chest, and after the chemotherapy, the cancer recurred again and again. When he did the cone beam X-ray of the mouth, there was a massive infection on the upper left tooth, number 14. The bone was eaten up completely with the infection for years, and the patient did not know. When they removed the tooth, same patient responded to his cancer treatment much better. Another study is that the bladder cancer patients, after surgery, the surgical site did not heal. Patient abscessed again and again, and antibiotic did not do anything. She was found to have a huge abscess in one of her front teeth that related to urogenital area. When the tooth was removed, immediately abscess went away on the surgical site. Dr. Jerry Tennant states that at a current rate, 53% of Americans will die from cancer. There has been increasing awareness documented in traditional medical literature about the role of mouth in many diseases, including cardiovascular disease. There has a link between cancer and a root canal or bone infection in the same acupuncture meridian. And he also states that dentists are the only doctor who purposely kill the tooth and leave the dead tissue in the body. The dead tissue in the body always gets infected. This is another Dr. Atkins' story. He saw a young child who went in coma right after root canal treatment was done. And after arguing about what caused those coma, the oral surgeon decided to pull the tooth out. And within an hour after removal of the root canal tooth, the child was awake and up and walking. So this is another demonstration of how lethal those root canal tooths can be. So now we're going to move to the bone infection. What is a cavitation? The cavitation refers to a toxic containing holes in the jawbone, often at the site of previously extracted tooth or root canal tooth. Most of the time, it is asymptomatic and cannot normally be detected by simply looking at the bone. Even with the use of dental X-ray, the vast majority of the cavitation are missed in dental and medical professionals. Cavitation has many scientific names, such as ischemic osteonecrosis, NICO, neuralgia-inducing cavitational osteonecrosis, or osteomyelitis. Here you have a panoramic X-ray that patient had 4 wisdom teeth taken out. you can't really see it clearly, but you can see like honeycomb-like defect around all 4 quadrants. They're showing the presence of cavitations. Yeah, it's not clear there. So what are some causes of cavitation? Failure to remove parallel ligaments, failure to clean out infected tissue during surgical procedure, poor nutrition and healing support from compromised immune system, chronic osteoporosis of the jawbone, or using anesthetic that has epinephrine during the surgery. Epinephrine is a blood constrictor. So if you use an anesthetic that contains epinephrine, then the blood supplies will be limited and the healing won't take place. So here we have a patient who had a wisdom teeth pull. And can you see this dark area here? It's hard to tell. Yes? Okay, good. And this other patient that there was a cavitation in this area. So what happened with this area is that normally the tooth are embedded in the jawbone that held by the periodontal ligaments. But when you extract the tooth, you don't need the periodontal ligaments anymore. So you need to remove the ligaments. But sometimes, dentists don't pay attention to those areas and they leave the periodontal ligaments. And there's a problem with that. The periodontal ligaments will act as a barrier, and the surrounding bone thinks that they get a missed signal saying that there might be a tooth inside, so bone cannot grow. The other problem is the periodontal ligaments will act as a barrier, and there's no the nutritional and oxygen supply in that area. So when you have a bacteria in your mouth, and they go into the socket after extraction, they become clever. Those aerobic bacteria will turn into anaerobic bacteria inside. And those anaerobic bacteria secrete toxins. They are different than aerobic bacteria. Aerobic bacteria normally probably okay, because I probably have a lot of bacteria in our mouth, and yours too. But once they become anaerobic bacteria, they secrete sticky stuff. It's the extracellular polymer matrix. It's a structural matrix for their survival. So they form what we call biofilm in those areas. And the bacteria cause all kinds of toxin, and that can go through the whole body after that. And antibodies cannot get to. We have a referred pain from cavitation. These lesions can linger for years without producing any local pain in the jaw, no swelling, and no referred pain in other areas of the body. But over time, if the lesion enlarge enough, they can begin to cause intractable, long-standing pain that reflects to distant area of the body, such as neuralgia or facial pain. So this is an example of the patient who has a facial pain. There's a cavitation, and the patient didn't know about it. The extraction was done 25 years prior, and those cavitation spread to the bottom of the nerve root area. There's an inferior alveolar nerve going on, bottom of the jaw, and that can spread to the whole face after that. So what is the treatment for cavitation? We first use a non-invasive treatment with the ozone first. Sometimes we may have to do the surgery and follow with the ozone injection to clean out all the cavitation site. I forgot to mention about those cavitation is when you don't remove the ligaments, those ligaments petrify and just stay there, and you have a dead skin living inside of your jawbone, and it's difficult to clear out from the body. So this is a case, it's a very interesting case. Patient came in because he wanted to have a crown removed due to the cavity underneath of this crown. And I took an X-ray, and I found this cavitation. So I told him about this cavitation, and I recommended an ozone treatment. So he's aware of such a treatment, and he was thrilled that I was going to do that for him. So I use the X-tip. X-tip is a device where you could actually drill through the bone, and you can inject the ozone gas into the hole here to deliver the ozone gas into the affected site. So I put an X-tip in there and drill and injected the ozone gas. Normally, I'll put about maybe 12 cc of ozone into the infected bone, but being an ozone lover, he wants lots of ozone, make sure that, I clean that area. So I injected about 3 syringes full. That's like 36 milliliter of ozone. And what I did was I pressurized the area. And I did it without knowing that I was going to do that. I just kept on injecting because he said, I'm okay if you're okay with it. So I said, let's go ahead and try. So after I injected about 36 milliliter of ozone, and he said, I'm having a lot of pressure now. I think we're done. So I think, yes, I think we're done. And as I pull this X-tip out, I saw this amazing toxic sludge shooting out of this sock area to the mouth. And I don't know if you can see this. This is teeth right here. That's a lower teeth. That's my gloves, and that's upper lips. So do you see this toxin? Biofilm, toxic containing biofilm coming out? That's amazing. So the next topic is, what is ozone? Ozone is a chemical compound consisting of 3 oxygen atoms. The elemental form of ozone occurring naturally as a result of ultraviolet energy or lightning, causing a temporary recombination of oxygen atom into group of 3. The form of oxygen that is formed by an electric discharge field of a corona discharge generator. It's stimulating lightning. The oxygen is the only gas that can carry an electrical charge. Ozone protects living organisms by surrounding the Earth at altitude of 50 to 100,000 feet and absorb the sun's ultraviolet light. The ozone being a powerful oxidizer and help clean the atmosphere of dangerous compounds. So here is an ozone generator that is simulating the lightning. And you have to have a medical oxygen grades that feed into this ozone generator to make ozone gas. This is an interesting study that they did ozonated water, and it shows how powerful this ozone can be in killing the bugs. So they use 4,500 bacteria, and they use 4,500 molecules of chlorine. And it took 3,500 seconds to kill 4,500 bacteria. And they did the same thing with ozonated water. And they got the same amount of bacteria, and it took only 1 molecule of ozone, and guess how long it took? It took only 1 second to kill 4,500 bacteria. That's really amazing. That's very powerful. So the property of ozone, it kills the bacteria, virus, fungal, and parasitic infection. It also activates cellular metabolism and increases ATP production. It also forms reactive oxygen species such as hydrogen peroxide. Reactive oxygen species is a natural byproduct of the normal metabolism of oxygen and has an important role in cell signaling and homeostasis. stasis. However, during times of environmental stress, reactive oxygen species level can increase dramatically, which can cause significant damage to cell structure. The reactive oxygen species is what's responsible for our aging. So this is a gentleman who used ozone for about 4 months. What he did was he bought the ozone generator and he did the rectal ozone insufflation every day. And this is a picture of October year 2013. Oops. He had a skin problem for all his life. And after about 4 months using ozone, look at how the skin changes. He looks about, I don't know, almost 10 years younger, isn't it? Yeah. So the oxygen ozone therapeutic goal is that it stores proper oxygen metabolism. It induces friendly ecological environmental by improving delivery of oxygen to anoxic tissue. It eliminates pathogens, increases circulation. It immune activation by upregulating lymphocyte. It stimulates antioxidant system. We have different forms of application of the dentistry. It delivers ozone into infected jawbone. We can inject ozone into TM joint for the treatment of pain and inflammation. We can disinfect the involved tooth during the root canal therapy. We can infuse the ozone into the infected root canal that previously treated. Ozone can be adjunctive periodontal therapy with the use of ozonated water, ozonated olive oil, and ozone trays. So this is the how can we deliver the ozone in the mouth? We use a little device called X-tip. And this can be drilled into the jawbone like this. And inside of this is hollow. So you can actually insert the ozone, the syringe needle that we can inject the gas into the bone. And that's what we do in the mouth. So the ozone root therapy. So having read all this, how bad the root canal is, it is really difficult for me to do the ozone root canal treatment anymore. So I decided that why not try to save from having to do the root canal. So what I've been doing since November last year is that I figure if I can give oxygen into the nerve and let the nerve regenerate and clean the tooth and disinfect the tooth, maybe tooth might be fine. So what I did was, even though nerve is exposed, you can clean it really good and inject the ozone gas. This is an example of an infected abscess area. You can inject the ozone right here. So the patient came in and he had deep cavities, and of course the cavity was at the nerve. So I told him about the root canal, and patient didn't want a root canal anyway. So you know, we injected the ozone gas into the canal, and I filled it with a ceramic restoration. And I did this back in November last year, and patient's fine. He doesn't have any symptoms with that tooth, and I'm monitoring him every couple months or so, and every time I talk to him, he says, it's fine, I have no problem. So far so good. And there's another case, same thing. You see the cavity was so deep that the cavity was already at the nerve. It's a bleeding point right there. I inject the ozone gas, and I filled it with the ceramic restorations. Oh, what happened to the another after? Actually, can you hand out those brochures? That same picture is in the brochure. That's a really good case, and I don't know why it's not there. So I'll wait for everybody to have that. Somehow I didn't get a copy. So let me tell you about the history of these patients. Patient came in with an implant in her mouth, and she went on massive antibiotic treatment. She was taking amoxicillin, penicillin for a month and couldn't control the infections. In fact, the infection was so bad that her doctor gave her IV penicillin, but that didn't do anything. So she was really big, and she was hospitalized for that. And they actually incised, they cut the face and drained the infection, you know, because the infection was pretty bad. So when she came to my office, that implant that was placed in Mexico actually was loose. So I sent this X-ray to oral surgeons who, you know, who does the implant, and everybody said, oh, you can't save that tooth, you got to take it out. But patient didn't want to lose that implant. You know, she asked me, can you save this implant? So I said, well, I cannot guarantee, but I'll try with the ozone. So I inject the ozone gas the same manner as I mentioned to you earlier, and I did about maybe 7 or 8 visits of ozone. And too bad I don't have a picture right here. I don't know what happened. Did you see that on the brochure? Yeah. The implant was solid, infection was gone. Patient went back to Mexico and had a crown placed. So she was very happy. This is a boy, a 4-year-old boy who came in, and he had a rampant decay. I mean, he had a cavity on every single tooth. And his previous dentist recommended that he need to be hospitalized so that, you know, they can put him to sleep to do the whole mouth. And that they recommended most of the teeth need to be root canal and crowns. So the mom came in, she heard about the ozone, and she asked me, is there anything I can do to save these teeth from having to do the root canal? So I removed this decay with a laser, and I cleaned out most of the decay, but I couldn't clean out everything because the cavity was already so close to the nerve. So at that point, I injected the ozone gas into those, whatever the remaining cavity that was inside of the tooth. And immediately, those brown spots turn into white. And normally, when you touch the decay, it's really soft. You can scoop it actually with a little, you know, excavator. But right after I inject the ozone gas, almost immediately, tooth became really hard and white. And I just picked that in, there's no soft spot anymore. So I filled it with BPA-free composite. Yeah, so the patient was really, mom was very happy. We also have ozonated olive oil that can be used on skin condition, insect bites, or gingivitis. You know, I recommend all my patients to take home with the ozonated olive oil so they can use it on their gums. Is ozone toxic? Yes. Our lung tissue does not have an anti-oxidant membrane in them. So if you breathe ozone directly, of course, you can damage the lung tissue. Lung tissue can only tolerate no more than 0.2 parts per million. So it is important to use the ozone gas bubble through the olive oil when you're inhaling. So this patient came in because for dental, but he told me that I have a bad flu. So I said, how'd you like to get rid of those flu? And so we did the nasal insufflation, and he said the next day he felt much better. Yeah. This is a patient who came in with the chronic fatigue, and she said that she needs to sleep all the time, the headaches, and she has a food sensitivity and the light sensitivity and lack of stamina and lack of libido. And she came in, and I took the X-ray, and I looked at these teeth, and I told her there is an infection from the root canal teeth. She had this root canal done when she was a teenager, and for 30-some years, she had this infection, and I took those 2 teeth out, and she felt much better, I think, and she's in the audience. And do you mind come out, and do you have anything to say about this, Kathleen? Huh? But I can't speak without a microphone. Right, that's right. Where is the microphone? Oh, there she is. Old age. Thank you.
Well, does anyone have a question? I don't know where to start, so if someone has a question, I'll answer it. Yes.
So when you
A microphone.
It works 2 ways. No. You need to hear it.
I'm sorry. How about I come out too? So when you had those teeth extracted, did you do anything after that, implant, or just space?
No, no, we have other plans right now. We're doing some cranial work, so.
I'll answer it.
Okay, sure. Go ahead.
So yeah, I have 2 fake teeth here. You can see I'm getting this bigger space right here. She's just wired some teeth temporarily, so I've lived with first dentures and then wired teeth for a year. This was done in April last year, so I'm almost at my anniversary. It's been a remarkable year. I have lived without front teeth. I feel like a real weirdo, and I have been so incredibly happy you cannot imagine. Because I feel like after 30-some years of kind of half-living life, I am just full of energy. I've just been proposed to in marriage. I'm in a school program, and while I went through this, I kind of couldn't think very well, so my school just kind of kept me supported even though I couldn't do work because it was so intense to go through this process. I was also going through chelation for Mercury, and we are expanding my mouth and cranium, which is also related to orthodontics. So it's been a very intense year, but it's kind of like giving me my life back that I really never had.
Thank you.
Are there any other questions? Yes.
Dr. Why did you not inject these teeth with ozone? Why did you take them out?
Well, because I knew that root canal wasn't done properly. So in order for me to save this root canal, and first of all, there's no way you can clean those dentinal tubules. So I already knew that it's going downhill. I could inject the ozone gas. It depends on the tooth. If I know that root canal was done maybe by me, that I use the ozone, then maybe I'll use the ozone in surrounding area. But this was done 30 years ago, and I knew that they didn't use the ozone, and it's infected. So the best thing I thought was just remove the tooth.
And that is that she will give me bridges eventually.
Right.
And I can assume that the libido is high?
Skyrocketing. Yeah, those 2 teeth, remember I mentioned to you on that tooth and organ charts, are related to urogenital, and that affects sexual function. And she said that the libido is just, she got a new boyfriend.
So is my understanding is that you can at times save a tooth that another dentist might say, oh, we need to do a root canal here, that you might actually be able to save that tooth from needing to do a root canal?
That's what I've been experimental, okay? It's not a standard of care in America, but what you got to lose? You try to save it with the ozone, and if it doesn't work, we can always do the ozone-assisted root canal. There's a better way to do the root canal, by the way, but I didn't cover that in this talk, but yes, yeah.
So how many people have you been trying this out with?
Right, I just tried it in November last year, and I have done 8 cases. And all those 8 patients are fine so far.
I would like to say I had trigeminal neuralgia. Stanford says trigeminal neuralgia, here's some pills. First diagnosis was a brain tumor, but that's fortunately wrong. Trigeminal neuralgia, gave me some pills, 1 shot of ozone, went away.
Does ozone injection in the jawbone stimulate stem cells to help build bone in the jaw?
Oh, okay. Okay.
Actually, can answer that question. I've had ozone in both my temporomandibular joints for TMJ. I've had Dr. Rowan do approximately 3 injections in both TMJ joints. Pain subside. Joint function is restoring itself. And I actually, because of clenching and severe grinding due to PTSD, destroyed my right temporomandibular joint, and there is some regrowth, and the left is actually stable.
Thank you. Yeah. That's what we see in our in the office too, because remember that X-ray that I showed you with the implant? I mean, that's the bone just grew. Yeah, definitely.
So I'm curious, for those who do have root canals, so one option that I heard is if you have a pretty good immune system, you may just get lucky and you can just continue living like this.
Right.
Right?
Right.
But maybe if you don't want to take the chance, what are the options?
If you already have a root canal?
Yes.
Well, you could get an ozone injection around it and try to keep those teeth as long as you can, or extraction.
And if the extraction takes place, then what, implant, or what goes after that?
Well, there's 2 different kind of implant. There's a titanium and there's a zirconium implant. And I would recommend zirconium implants because titanium, acts as an antenna for this battery effect in your mouth. So you can have an implant done, but it has to be zirconium implant.
Well, too late for me, but thank you.
Too late for you? You have a metal implant already? Okay.
So besides a panoramic, which often does not show a cavitation, what other kinds of tools do you use to determine whether or not someone may have cavitations?
Muscle tests.
Muscle testing?
Yes. Yeah. I do applied kinesiology, and I'll determine the cavitation site through the muscle test.
What's your favorite oral antimicrobial for daily use?
Oh, for daily home use, ozonated olive oil is really good. Hydrogen peroxide. Yeah.
What's your personal detoxification protocol?
For which detox protocol?
For whatever you do yourself for general detoxification.
Well, I'm a dentist, so I'm just constantly exposed with the heavy metal. So I use like vitamin C, glutathione, lipoic acid, IMD.
So what do you think in general of Chris Shade's protocol through Quicksilver Scientific? Do you find that works well for most of your patients?
Yes, I really like IMD. IMD is an intestinal metal detoxifier. It really binds the mercury and get it out of the gut. So I do recommend IMD for my patients, yes.
And do you think that nasal insufflation of ozone can help for people that have chronic fungal sinusitis?
For nasal, yes, absolutely. The ozone can kill fungus, virus, and bacteria. So definitely, if somebody has a sinus infection, they will take care of it. I was sick well, my son was sick first, and you know, he had a sore throat, and he was having a high fever, and really, really sick. And I got it next day. Soon as I put a nasal insufflation, my flu went away in just one day. Yeah. So.
What is IMD to everybody? What is that?
IMD is called, stands for intestinal metal detoxifier. It's the microsilica products, and it's what it does is when it binds to mercury, it makes the whole compound large so that you don't get reabsorbed in your gut. Yeah.
So where do you get that?
Quicksilver Scientifics. You can go to www.quicksilverscientific.com. In fact, Quicksilver, yeah, Quicksilver. In fact, we should invite Christopher Shade here. I mean, he has a PhD degree in mercury toxicity, and he's amazing. Yeah, so we should definitely invite him. In fact, I talked to him 2 days ago, and I told him about this, and he said, well, would you like to come and talk here? And he says, yes, just invite me. I'll be there.
Can he
so,
come in June?
Yes, he can come in June. Yeah. Okay, I will. Thanks.
I have 2 questions. One is, is it true that ozone is dangerous in the lungs?
Yes, as I mentioned, if you inhale ozone, absolutely yes.
Right.
Yes.
But now, when you work with it in the mouth, is it possible to inhale it by accident?
Yes. Small amount of ozone is fine. You know, Nick was saying the other day that, what was the thing that you were saying? Can you comment that someone who had, staff had a flu, working in a dental office, and the flu went away, right? So the microphone.
There's a number of, should I stand up?
Yeah.
There are a number of practitioner groups that report anecdotal, that better? Anecdotal, that freely report anecdotal events with each other. And one of them was a physician who's, a dentist whose destructor, ozone destructor, is a device that you have that actually in a closed room will, I don't need to go into what destructor is. Basically, it gets rid of whatever else you've got going.
Scavenger.
That you don't use. And it wasn't working, and he didn't know about it until they started smelling ozone. Well, the story is that 2 of his staff people had colds, and by the end of the day, the colds had disappeared. But be mindful that the parts per million were very low, like Dr. Hong mentioned, is 1 or 2 parts per million. More than that, you feel it, you start coughing. I've made the error of actually ozonating some water and leaving some space at the top of my jar and I drink ozonated water. So I go to breathe it, and the ozone, heavier than air, was there, and I was coughing for 15 minutes. That wasn't very pleasant.
Yeah. So, a small amount is okay. The only bad thing is it makes you cough. Yes?
Could you go over again the nasal insufflation? Are you ozonating water and then putting the water in the nose?
No. So the ozone goes into the vial that has ozonated olive oil. So actually what's coming out is you bubble through the olive oil. So ozone gas come from the ozone generator, go to the vial, and they bubble through it. It changes ozone gas to the carbon hydrogen compound. So it's safe to breathe on it. And you don't even smell ozone.
Okay.
Yeah.
You can't do that with water. It has to be the oil, right?
Right. Yes. Precisely.
That oil does not then harden up like ozonated olive oil.
It does if you do it. If you constantly put a ozone gas, but I don't want to waste my oxygen, so I don't do that. But that's how the ozonated olive oil is being made. It's very concentrated ozone in the olive oil form. Yes.
I do have an ozonated olive oil. And is there a percentage of
ozone that should be in it to be more effective? I know there are different brands and some, you know, I don't, there's oxygen and a percentage of ozone to the olive oil. So is there a percentage of ozone that should be there to be more effective?
Yeah, you can't really, unfortunately, you can't really tell the concentration of ozone in the olive oil, you know. You just have to smell it. If you smell it, then you still have the ozone in there. And if you can store the ozonated olive oil in the refrigerator, it will last longer.
Yes.
So
it says to refrigerate it. I want to say it's globalhealingcenters.com, and it was about $30 for a jar of it, and it gives the breakdown of what's in it, and you can smell it. You can taste it too when you put it on your gums.
Yeah, absolutely. Yeah, so if you can smell it, there's such a potent oxidant, so you know that will still work.
Did you say again, Michelle, where you got it?
I think it's globalhealingcenters.com. It's called O2ZAP.
Violating the rules.
Yeah, the Ozone Services also sells those, and there are many companies out there that who sells ozonated olive oil. Mm-hmm.
Anybody else?
You had mentioned using hydrogen peroxide or ozonated olive oil for oral care.
Mm-hmm.
What's your experience of one versus the other? Do you think one works better than the other? Do you think they're equal?
Not, you know, everybody has ozonated olive oil. So for regular people, you can just get hydrogen peroxide. But I would say that it depends. You know, if you want to use it every day, maybe you can use hydrogen peroxide. Actually, you should use ozonated olive oil every day. So do I prefer one or the other? I would prefer ozonated olive oil because it works better.
You think it's stronger?
Stronger, yes.
Thank you.
Mm-hmm.
So you put on your gums, is that what you're doing with it?
Yeah, you take out a little bit of ozonated olive oil, and you can do it with the two things. You can use a little small Christmas tree-like brush. Have you seen those little brush that you can actually go in between the teeth? Yeah, you can dip those into the ozonated olive oil and just go in between the teeth. There's another device called, it's a rubber tip. I wish I have it here, but there's a rubber tip that you can stimulate the gum, and you can also dip those rubber tip and go under the gum and clean it that way. Mm-hmm.
Just a quick question. Any thoughts on oregano oil?
Those are really good. They are anti-inflammatory. I mean, I would definitely recommend oregano oil or tea tree oil and things like that too.
But I'm saying applying like you would the ozonated olive oil in a similar capacity.
Are you saying that you put ozone into the oregano oil? No, just the oil itself. Yes, absolutely. I would do that if you don't have ozonated oil at home.
Yeah.
You can do the same thing with a little Christmas tree-like, or you can use a rubber tip. But the problem is that it's oil, so it's hard to, you know, to apply sometimes.
Mm-hmm. Mm-hmm. Thank you.
You're welcome. Yes.
Can we go back to now it's getting questions and answers?
Yeah, I'm actually done.
Okay, so I have a couple of questions.
Yeah.
First of all, it looks like your preferred way of treating cavities is laser. So you don't drill teeth, you just use laser, or a combination of those?
I use a combination of those two. I love laser, so you know, anytime if I can use a laser, I will use it. Laser, benefit of laser is you could sterilize the environment as well as removing it. So laser is a better way. The problem is that the handpiece is faster. So when you're running out of time, you want to just shoot it out really fast sometimes.
Okay.
Yes.
And the other question that I have is, do you believe that you can reverse cavities with a change in diet? And if you do, maybe can you talk a little bit about that?
Well, you know, obviously diet definitely helps. Weston A. Price did the research on, you know, those native people who has a diet versus somebody who moved to the you know, modern diet. So diet helps, but whether we can reverse the decay by changing diet, I'm not sure. It will help for sure. You eliminate sugars and, but I'm not certain about that.
Carry on.
Okay. So this is actually last slides. A friend of mine came in with a problem like this. It's a mess. She had a cancer in the past and chemotherapy. And the whole body looked like this. And I just didn't know what to do with it. And I told her that, oh, maybe, let's try ozone. So I gave her the rectal ozone insufflation. And this is after 3 trials. She came in with the swollen legs, with like so raw, looks like it's gonna bleed. And this is what happened after 3 visits. And you see that, look at all this mad looking skin, and it was healing already, it's going away. I supposed to see her today, but I had to cancel her. And this is she had this lesion all over her head, and I took a picture right above the ear. I don't know if you can see it, but there's almost open wound here, and you can't even see it. It's closed down with the 3 ozone. So that's it.
So I have a question for you.
Yeah. Thank you.
Once again, go over and explain what is the magic of the ozone therapy? Why is it magical?
Well, ozone kills the bacteria, virus, and fungal infection. So it's a potent germicidal effect. It also, there's an initial effect and there's a latent effect. It also stimulates the immune system. It also metabolizes those oxygen and produce ATP in your mitochondria. So it has the initial effect as well as latent effects.
Starting the meeting off. Guys are yakking now.
Well, one of the things that I ran into early on when I was just getting into Smart Life Forum back in the 90s was a doctor that, Ebnather, who told me that you could irradiate blood with ultraviolet light and kill infections. And I thought, this is the craziest thing I ever heard. And since then I've come to slowly understand that there's a lot of things that sound crazy that actually work. But I have a friend of mine in Chicago, a wealthy gentleman who's on the board of Northwestern University. His project is to get the university to use UBT, ultraviolet blood treatment.
Right, that's what Dr. Robert Rowan does.
Okay.
And he will,
yeah,
speak
Robert.
about that
As a matter
next
of fact, he worked with Robert Rowan on this. His name is
Right.
Richard J.L. Senior. A lot of the people here, some of the inner community might say, had dinner with him in Saratoga, at my expense. But that was a wonderful evening. But I wanted to just mention this, that in Europe, and especially in Russia, the Ukraine, and Eastern Europe, quite a number of doctors use this routinely. It's very safe, it's quick, it's inexpensive, and I think the way it works, the reason I mention it, is because I think when they take the blood out, and they take the blood out a small portion,
right.
run it through, irradiate it with ultraviolet, I think what they're doing is oxygenating the blood. I think that's how it works. Now, that's just one theory, but anyway, I thought I'd mention it.
I think the AMA is against the process, if I'm not mistaken, correct?
Yeah.
Because I had it done by a doctor down in Santa Maria, and I call up there one day, and he was out of business.
Oh, that's too bad.
Have you ever tried the ozone on, or injection, say, in foot fungus?
To who?
In foot fungus, like intractable?
Oh, yes, definitely. We have an ozone bag
Put your foot in your mouth.
that you can actually put, ozone gas into the bag, ozone bag, and the fungal infection works really great. You can also use ozonated olive oil. A lot of my patients comes and buy a ton of ozonated olive oil. You know why? They give it to their coworkers and their husbands, and they all want it because they want to use it on their toenails. And everybody said it works so great. Nothing really worked in the past soon as they put ozone and olive oil, the fungus goes away. Yes.
Another good use for ozone is I'm a breast cancer survivor, and I had a pap smear, and it turned out abnormal, so they were very worried that the breast cancer had went into the uterus and stuff. So I found a woman named Georgia Tripp that's out towards Santa Rosa, and she did vaginal insufflation, and at first it burned and it was horrible, and I did it for I think a series of 6 or 8 of them, and then I went back in 3 months to have another pap smear, and they said that my pap smear is normal now. So I have the abnormal one and I have the normal one, so I think it actually helped in this case.
Oh, great. Wow, that's awesome.
I'd like to say I actually took a client of mine to someone named Dr. Josh Donaldson in Capitola. He was recommending you, actually. And she had vaginal insufflation yesterday, and her daughter has had it twice and had remarkable results for fibromyalgia and extreme PTSD from a traumatic...
Just 2 visits.
2 visits. And this client that just had the vaginal insufflation, I had taken her to Dr. Rowan, and he had done 1 injection in the knee. She originally went to him for knee pain and of the ozone, and then she had positive results, but still had the pain. And we ended up going to someone a little closer to her instead of having to drive 3 hours. And she ended up having about 14 injections of the ozone, and it just didn't seem to be taking. So we went back to Rowan, into her knee, went back to Rowan, and he said he was just blown away by that. That was his specialty. He's never seen that. And then he made the conclusion it has to be the tooth. So he did the empirical tooth chart. He looked at the tooth, and he said, you have 3 root canals. It's one of them that's causing it. And he suggested having the tooth out, which she did. She didn't for a few months, and she just had it out about a month ago, and the next day she was walking with no knee pain at all. And he said he's convinced that the degenerative issues she had in her back were caused from that root canal.
Correct.
So after she had the tooth out, she's had no problems. Now she's having vaginal insufflation, and she's just really into the ozone. So I took her there. I saw the whole thing with her, Dr. Rowan and this Dr. Josh Donaldson, and it really is fantastic.
Right, yeah. That's, obviously really unusual, because when you have a knee problem, the ozone takes care of it within just the 2 visits. But if you have a lingering issue like that, you always want to look for the teeth.
So the secret is no teeth and ozone?
That's not a good idea.
I just want to mention an alternative way to take care of gingivitis is with a toothpaste that is based upon a chelation type of therapy to get rid of biofilm, but the side effect is that gingivitis goes away within days, absolutely goes away, and it's been done in many, many, many cases in clinical studies. So, and studies done at University of Irvine. It just goes away within a very short period of time. I'd love to tell you more.
What's in it? I know. But
yeah, the basis of that whole toothpaste is a permeation enhancer with a chelator. And what happens, 2 things happens with that. It gets rid of biofilm better than anything else that is out there by orders of magnitude. And that alone helps get rid of the bacteria that causes basically the problems with gingivitis. The second thing is that if in fact you get, anytime there's damage in tissues, the cause of inflammation is calcium gets into the tissues, and that initiates the cascade of reactions that form the inflammatory cytokines. So if in fact you can capture that calcium right at that site, it in fact becomes a powerful anti-inflammatory. So 2 things: you get rid of biofilm in an unbelievable way, and B, gingivitis, because you're getting rid of the causes of the whole cycle that's occurring. It just goes away within days. It's amazing.
Wow. Thank you. I'll look into that. Thank you very much.
So what was it? What's the tooth? Is it toothpaste? What's the toothpaste?
It's called Livionics Dental Gel. There's a little brochure on that, and it's and there's some graphs back there, but it's.
No mic for you.
Any thoughts about oil pulling with coconut oil?
Yeah, I always recommend oil pulling to my patients. Definitely, it's any oils actually is really good. But if you use the coconut oil, that's really good. You can use the sesame oil. Anti-inflammatory.
Any tips that you have for helping with gum recession or rebuilding enamel?
That's another topic. You have to find out why there's a gum recession. And the most common cause of gum recession is a tooth position. Tooth position. Yes. If the tooth is uprighted from the bone, then there's no recession. But if the tooth is lean or rotated, then you have, every time you bite, you have a shearing force going into the tooth, and the gum gets receded. So it has the tooth position. You have to find out your occlusion and see what can you do about it. And the second question was, what was the second question? Rebuilding an enamel. Ozone helps. Yeah, ozone helps. And also there's a toothpaste called MIP. It's a mineral-based toothpaste. You can apply it. So combination of those two. But the problem is that you have to find the cause why there's recession.
Are you a fan of organic coconut oil?
Yes, definitely. Absolutely.
A lot of questions for you.
That's good.
Doctor, when you're doing the insufflation nasally through the coconut, through the olive oil, is it just a couple of whiffs and that's it?
Oh no, I put them on for 10 minutes.
Oh, so they're breathing there for 10
yes,
minutes?
Yes, right.
So you have a nasal cannula in both nostrils?
Exactly. Yeah, you saw those nasal cannula, yes.
Now, are you using 36 gamma for most of your use?
Oh, for the nasal insufflation, I use a lot less. For the 39 gamma, I inject the bone, but for the nasal, I use about 20. Yeah, sometimes less than 20. Depends on if the patient smells a lot of ozone, then I cut it down a little bit.
This is going to be our last question.
Thanks for coming, Dr. Hong. Wondering if you could help me understand again why the ozone is killing the infection and not the human tissue. It's just kind of new for me.
Good questions. Our human tissue has antioxidant membrane in them. The bacteria and the fungus and virus do not. So they attack those membrane versus human, except our mucous membrane. Did I answer your questions? Yeah.
It's killing the bacteria because of the extra electrons or something? Or what's killing that bacteria?
Ozone is highly negative. What is a bacteria? Bacteria is highly positive. So when they come in together, it actually neutralizes those bacteria.
So it's almost like shredding it or something?
Yes, they just instantaneously shredding it.
Let's give the doctor a hand tonight.
Thank you.
We'll take a 10-minute break and then we'll have the short program.